Hi guys, welcome to No Spring Chicken and the Laser and Skin Clinic in Dublin here. I am with the lovely Anna, who is the owner and founder of the Laser Skin Clinic in Dublin. I am here after getting a couple of different therapies done with Anna, or treatments should I say, and once I said I was coming in here, I was inundated with questions from followers who wanted to know a little bit more than just your average skincare, so I thought I'd come to the expert because this lady knows everything about skin. And you are actually a registered aesthetic nurse, isn't it, Anna?
Yes, registered nurse and 17 years working in the aesthetic environment.
Fantastic. Well, if this lady knows anything, it's her skin, so she'll know a lot more than me. As you can see, she looks absolutely fabulous. So I'm going to start off with some questions here that I got from followers, and then Anna, if you just want to answer as we go along. What is the best treatment for hyperpigmentation?
Okay, well, there's different types of pigmentation, and everybody at different ages comes with different amount of sun damage or pigmentation. So there's from freckles to your sunspots, your keratosis for the older client, or you can have melasma, which is like a patch of pigment, which can manifest itself in different areas
pregnancy,
of the face.
that happens sometimes,
pregnancy
doesn't it?
mask. Also, people can get it if they're on the contraceptive pill and they've been exposed to the sun, so it's a reaction in their skin. But generally, it's like everyone has a different amount of melanin in their skin genetically. So how they react then to the environment will determine what type of pigmentation they get throughout their life.
Right, okay.
And then we have to manage that and treat that depending on the extent and the type of the pigmentation they have.
Okay. And is there any particular treatment or product that you would say if you have it, you need to
Again,
get this?
you have to be assessed to which type of pigment you have. So you can do lasers, peels, you can do topical lightening products.
Great.
But we would assess what the person needs and what would be the best option for them based on the type of pigment, the type of skin they have, the tone of skin they have, and what their expectations are and what they're willing to, I suppose, put up with the recovery time and the amount of treatments that they need. But it's all about the results, and we would advise them on many treatments. It could be a once-off treatment. It could be a combination approach. So it could be actual skin peels with topical products. Or it could be a laser treatment with topical, and then to protect the skin afterwards to prevent new damage happening in the skin.
So it's not a one-size-fits-all. I think that's what people kind of think. There's just one answer for each skin condition, but it's not.
Pigmentation is very broad. We would have to customise a programme to deal with their particular pigment and wherever that pigment is, and what's going to be the best option for them, the safest and the most effective option to get the best results.
Okay. What's the best way to treat the turkey neck or the saggy jowls? Because I have a lot of followers who are in their 30s and 40s, and we're all starting to, gravity is going against us, so what can we do to fix that?
Well, there's two things that happen when you get loose skin. Your muscle tone can get loose or have laxity, and also your skin will get lax as well. So sometimes people can mix that up. Some people have both, or some people can have one aspect is getting loose. So we've many treatments to tighten the skin, and we have from lasers will tighten the superficial part of the skin. Radio frequency will tighten the dermal part of the skin, and then therapy, which is ultrasound, will tighten the muscle part of the skin. So we can combine these modalities, or we can use one depending on what that person's laxity extent is. So I mean, the ultimate treatment for muscle tightening will be therapy. It's ultrasound, it's focused energy, it's directly targeting the muscle to tighten that muscle. But even the outer part of the skin can get a little bit lax, that crepiness, that laxity of the skin, the quality of the skin can get a bit loose, and there you need to use treatments like superficial lasers, so maybe even some mesotherapy profilo to improve the quality of the epidermis.
And leading on then from the kind of jowl area is another one that was asked quite a lot, was the under eyes. A lot of people are starting to see the crepiness, bags, dark circles, and their kind of traditional creams are not hitting the mark at the moment, so they're wondering what they can do to just kind of brighten everything up around the eyes.
The eye area is again a complicated area because it's multifaceted. Because you've got changes in the bone structure, the muscle and the skin, and as we age we lose the padding around the eyes. The fat pads move downwards, so then we become more hollow around the orbital rim, so then we start looking tired. The quality of the skin around the eye will change because it's a very thin skin, so it's moving all the time. It's a lot of wear and tear, so the quality of the skin around the upper and lower lid will change as well, and it's very fragile. If somebody comes in, we will correct maybe the hollowness first, and then we will improve the quality of the skin by treating maybe with some PRP. We can use some lasers, we can use some mesotherapy. We can use Ultherapy to lift the brow and tighten up the muscle around the eye.
Yeah.
But we may need to use some treatments superficially, like your own blood cells, like PRP, like mesotherapy, to improve the quality of the skin on the outer part.
Right, okay. And that PRP is what people would think of as the vampire facial, isn't
Vampire
it?
facial,
Yeah.
which is excellent because you're giving your skin stem cells.
Right.
You're giving your skin back everything it needs to repair and remodel itself, to become a healthier, more elastic skin, to be able to withstand the wear and tear of movement on a daily basis.
Okay.
Or even using topical products. If you get the right products for your eye, some stem cell like Dr. Levy products,
Yes.
and even using some stimulating eye products will improve the quality of the skin. But that's getting the right product.
Yeah.
Scientifically proven to deliver active ingredients into the skin to change the dynamics and the quality of your skin.
Yeah, and I think that's something I know my followers are very interested in. They're at the age where they're not just looking to hydrate the skin. They really are interested in the ingredients and the research behind it and the scientific research, because there's plenty out there that claim that they can take 10 years off you, but you have to really research, I think, your products.
Yes, it's all about delivery. It's not about brands. It's about the delivery system that's inbuilt into the product, and also the quality and the percentage of the ingredients that you're delivering. So a cosmeceutical will have a therapeutic action on your skin to change the dynamics of your skin. Unfortunately, cosmetics, they're not scientifically researched to deliver that quality and percentage of ingredients into your skin. You're better off having a few quality products than having a lot of cosmetics in your bag.
Yes, I understand, even though I am a cosmetics fiend, but I've the older I've gotten, the more I've realised I need products that actually work. And when it comes then to ultherapy and that kind of thing, what age would you say you should start looking at that? Because you obviously don't want to leave it too late where the damage is so bad that you can't kind of turn back time, but you do want a more of a preventative treatment, I suppose. And so if you're looking at the likes of ultherapy and something that's a little bit more of an investment, what kind of age group would you think should start looking at that?
I think we've seen that it will be, usually people will come when they see the laxity or the jowl area, or they feel their face is dropping. You will see the client coming at that stage, which the process has started. And there is an ideal client for ultherapy, which would be the early stages between probably 40s to probably late 50s. But if somebody wants preventative treatment and they want to have it done even before they see laxity, that's going to stimulate and tighten the muscle layer and the skin anyway, and it will definitely prevent you having progression in that aging process. Sometimes clients do come when it's actually quite advanced, an older client, and they may be aware that it's not going to be a surgical procedure, but they will be aware they will get some improvement, but maybe not like the same as having surgery. But they're happy to go down that route because of the low risk and that they will see results in 6 months.
If somebody is starting out using retinol, would you recommend that they start at a certain age? Should they be doing it starting in their late 20s, early 30s? What percentage should they be looking at? I think people get very confused by the science of it. So it's just to kind of give people an idea of what they should be doing when they start to say, I think it's time for retinol.
I mean, there's so many vitamin A's available on the market. There's all derivatives available. So you need to be very careful again what you're buying, because again, it's the quality of the vitamin A, the retinol. You have your pure vitamin A with tretinoin, which is a prescription product. But as long as you're using retinol, a good quality retinol, maybe 1%, you are causing stimulation within the skin. Retinol will improve the turnover of the cells, so it'll actually activate your skin when you were younger. So what you're doing is you're increasing the activity in the cell turnover, so you're pushing up new skin cells and getting rid of old skin cells. Because when you're younger, your cycle was a lot faster. As we age, it slows down. So retinol is a multi-functional ingredient. It decreases oil production. It works on the sebaceous glands to improve oily skin or acne skin. It also shrinks pores. It will soften fine lines. It will improve texture, but also it will stimulate the skin and exfoliate the skin. And there is a lot of misconceptions about vitamin A out there that, I'm going to be shedding, going to be peeling. But the whole concept is that you're activating the skin to wake up, because your skin stops working from the age of 27. So you want to start a vitamin A maybe in your late 20s and start using it maybe a couple of times a week, just to keep that activity and that stimulation within your skin, and not that it doesn't get too sluggish and slow down, because we're depleting in collagen every day from the environment and from aging. So unless we're doing something active in our skin every day or every few days, things are going to slow down. We are going to start seeing fine lines in our late 20s in areas where we're moving our face. We're going to start seeing. So it's always good, but to buy a good quality vitamin A or retinol is very important. I mean, and that's the thing, the delivery system again, we're talking about delivery system. It's to get that active ingredients to where it needs to go, to have that action is very important, because a lot of retinols you buy will sit on the surface and they've no delivery system, they're not doing anything, and the percentage and the type of retinol is not really going to be the best quality to make a difference to your skin. So you're better off investing into a more of a cosmeceutical retinol rather than a high street retinol.
Yeah. Now, a lot of my followers, I think as ladies get older, sometimes I think their skin changes, the environment changes, their hormones change. And I've found that a lot of people are saying that they're breaking out more than they even did as teenagers. And they're finding it difficult to kind of work the skin to make it kind of calm down, get less inflammation and all that kind of thing. So is there anything that you would recommend that these ladies can do, or gentlemen of course as well?
Well, I mean, as we see in the last 15 years, every second person that comes into our clinic has some form of oily skin type. And you develop your skin type when you become a teenager. So your skin is perfect, and then all of a sudden you get, whether it's an oily T-zone or you get mild breakouts or you get full-on acne. So different grades of acne. So, I mean, if that's not managed properly, it can develop into more of a problem for people. So if that oil gets out of control and it gets clogged, you're going to get infection, you're going to get breakouts. So it's how you're managing your skin, and that's down to, again, your cleansing, your toning, but using the active ingredients to dissolve and control the oil that's sitting in the upper part of your skin, and then to suppress the oil production using vitamin A as well. So really we educate our clients on what they actually need on a daily basis, because you can come in and have a peel done for acne every couple of weeks, but what are you doing on a daily basis? Because you're producing oil on a daily basis. But it would depend on the extent of the acne or the congestion we can deal with. But the main ingredient that will work on any oily skin is salicylic acid. And salicylic acid, again, it's down to the percentage and the quality. And it comes in cleansers, it comes in toners, it comes in pads, it comes in some products as well, like lotions. And that's really to dissolve the oil and break down the oil and remove some of the excess dead skin cells that are sitting on the surface. So it's a gentle exfoliator. It's not, glycolic is not suitable really for acne clients. It is okay for maybe congestion, but salicylic is the gold standard for acne. But you can combine glycolic and salicylic in a cleanser if you have a mild congestion or more like mild breakouts. But that would be something we could discuss at consultation level. But you need to exfoliate, and you need to dissolve some of that build-up in the upper part of the skin. Then your products, like your moisturizers, all need to be oil-free, small molecule. You need to be very careful about what products you're putting in your skin. You don't put oil on top of oil. You have to be careful with your serums that they're not oil-based. Your sunblocks as well, that they're oil-free. So you're minimizing all of this congestion problem. Your makeup even, that you're not using like products with a lot of oil in the makeup, has a lot of primers in them. They will cause major problems. Your powders should be, your blushers and bronzers should be minus talc. Talc creates a lot of congestion. So all of these things will clog up the pore and trap the oil. And when the oil gets trapped, it gets infected. So if the skin can't breathe, then you will have a lot of problems. I think that the problem is that people are buying like abrasive scrubs, and all of these scrubs are not medical grade crystals. So what happens is they're actually tearing the upper part of the skin, and they're losing a lot more moisture. So they're complaining of having oily skin and then dry skin because they're interfering with the barrier function. So they're actually being too abrasive and thinking that's the best thing to do to exfoliate the skin. Whereas if they let the product do the work for them and let the ingredient do the work, it's much more gentler and much more effective to actually use your salicylic cleanser with a face cloth. And as simple as it is, it actually does a better job than fingers or wipes, or you need something to actually remove your makeup and your dead skin and the excess oil. Then your toner will work more will seep into the pore and dissolve some of the build-up. So toners are important as well, because they will actually work a little bit deeper in the pore than the cleanser can get in. And then if somebody needs to have combination therapy, they may need to have skin peels as well, because their acne is at that level. So, and some people will need to go and get medication. If it's cystic acne, they will need to get proper advice from their dermatologist or from their GP. And they may need to go on antibiotics, because we don't want that acne to cause scarring. And if bacteria is left on the skin long enough, it will cause a scar, because it will destroy some of the epidermis and the person will be left with scarring. And there is some cases where they have to be referred to their GP or to the dermatologist, because they need to have systemic therapy rather than topical. So we would definitely assess the client and recommend topical and in combination sometimes with some skin peels.
Right, okay.
And then if the person has some scarring, we would move on to treatments for that.
Great. So just following on from the acne question, a lot of people as well have mentioned that they've developed rosacea later in life. Some of them have had it for a long time, and some of them have noticed that their skin is just starting to look more sensitive, from kind of redness into more of the kind of full-blown rosacea. So how would you recommend treating that, or what can people do, or are there any particular treatments that would work to calm that all down?
Again, rosacea is it's an inflammatory condition that can usually start in your could start from your 20s onwards. It can be manifest itself in the mid part of your face, so normally like around the nose and the cheeks. It can happen in men and women, so they don't really know the 100% cause of why it starts. They do know a few things, that it can be in fair-skinned people that have more rosacea.
Right.
There can be a little bit of maybe genetic history of rosacea as well. We see it a lot as well where clients have either they're very oily or they're very dry.
Right.
But the original cause is not 100% known.
Right, okay.
But once you develop rosacea, you will have it for life. So it can flare up and it can go away and flare up, and then you've got to try and find out to the best of your ability what's the actual causes of the flares to try and keep it under control. How we treat in the clinic is that we would assess the client and we would recommend some products to repair the skin, hydrate the skin, and improve the balance or the barrier function of the outer part of the skin, so it's not so irritated, trying to reduce down the redness. So again, we would have to assess that client to advise them, depending if they're more on a drier side or more on an oily side. We would customise the home care routine for them, and then we would look at if we can reduce down the redness with some IPL or some laser. So that's generally how we treat rosacea. And if someone has, I suppose, very, very angry or inflamed skin, they may need again to be referred to the GP. Some people will be on medication for rosacea, like an anti-inflammatory,
because it can be quite painful, can't it?
Some people can be on medication, and then they can also be on very good quality cosmeceuticals to improve the whole quality of the skin and the sensitivity, and also the to improve the flares and to calm down the skin.
The consultation really is the most important part, really, isn't it?
It's important to take a history.
Everybody's so different.
To see their lifestyle, and maybe we can see some of the triggers that's actually causing the flares as well, that we can kind of advise them on.
Another one, Anna, that I actually got from a few ladies who are going through chemo at the moment, and their skin is acting up, and obviously they've got so many chemicals in their body at the moment, they're afraid to use certain things on their skin. But is there anything that would be gentle that you could recommend, or is there any treatment that you think might work for them, just to kind of give them a boost?
Well, things like sometimes they complain of dry skin when they're going through chemotherapy, or they feel that their skin gets a little bit dry and a bit dull, and again, like gentle exfoliation, hydration, something like Dr. Levy, which is stem cell technology, which is going to like repair the skin as well. Dr. Levy has got everything in it, so the main thing is it's got stem cells, which is going to like a daily dose of your own stem cells.
Right, okay.
Synthetically, it's plant extract, so it's identical to you having maybe like PRP. So it will give back kind of what you're missing in your skin. But in Dr. Levy you have vitamin C, you've got vitamin A, you've got a combination of peptides, so it's like one product has everything in it. So it's very easy to use for people who are actually maybe busy, they can have a very simple routine at home. So Dr. Levy comes in a Dr. Levy serum and a Dr. Levy booster cream, and basically that's stem cell, which was definitely going to repair fragile skin. So if you want to improve the quality of the skin and repair it, Dr. Levy would be my choice. But you can use in combination with some vitamin C serum, or mild exfoliation, just to improve the dullness or the texture of the skin as well. Dr. Levy is famous doctor from Switzerland, and there's nothing like it in the world. It's very exclusive to us. There's only 2, I think, clinics in Ireland
great.
Dr. Levy, so we are very lucky to have Dr. Levy available to us to actually give to our clients. So it's a fantastic product. It's standalone stem cell technology that's never been seen before.
Fantastic. A lot of people have heard about cool sculpting for the body, but I had it done on this area here to kind of, you know, get rid of some of the fatness. But so it can be used for the face, but it would mainly be, obviously you wouldn't use it everywhere in the face. It would be just under here to kind of streamline the look as such.
This is the most popular area for you know, for excess, you know, fat in that area, which is very common. It can be used on the arms, it can be used on the flanks, the abdomen, the outer and inner thighs, the banana roll, which is just underneath the buttocks.
Take it all.
So, you know, it's amazing. It's an amazing treatment. It works, and you see the results in 12 weeks. So it's approximately about 20%, 25% fat reduction, permanent fat reduction, non-surgical fat reduction in one treatment. So it's ideal for stubborn pockets where people have had exercise, they looked at their diet, they've done everything they can, but they have a little area that they've always known maybe is a stubborn area for men and women.
Yes.
So, you know, it's a very safe treatment, it's a very quick treatment, it's a very effective treatment, it's the number one fat reducing treatment in the world.
Right, okay.
It's FDA approved, it's safe, it's very comfortable, there's minimal downtime, and you can have multiple areas done in one day.
Great.
And it's amazing, we're very lucky to have it. I mean, everyone's got areas that bother them, everyone's got, you know, whether it's their skin or it's an excess area of fat or loose skin, everyone's got something that bothers them. And at the clinic, the Laser and Skin Clinic, we have got a menu of treatments that we can pretty much treat everything except for surgery. So lots of people now just want to do as much as they can without cutting or without going through the risks or the downtime or recovery of surgery. So it's that combination approach to try and treat your skin early before it actually gets advanced that maybe it will be a surgical case.
And if funds are limited for certain people, like maybe not everyone can afford the likes of Ultherapy, would you still recommend coming in and looking, getting regular facials just to kind of look after the skin?
Like radio frequency. We've always used radio frequency, and it's a proven FDA approved skin tightening treatment. It may not go as deep as the muscle, but it's going into the dermis, which you have your collagen and elastin fibers that get loose, and that will heat the fibers up to 40 degrees and they will retract and give you a tightening effect. And there's other options, people, if they just don't want to go to therapy or they're not ready to do therapy or their budget doesn't allow, we have other options.
There's other options. Fantastic. So Anna, one more question just to finish off, if you don't mind. Droopy eyelids. Now, I naturally have hooded eyes. However, I've noticed over the years that they're starting to now nearly sit on my actual lashes, and I think a lot of people have that difficulty as well as they age. So is there anything that you can recommend to give that little bit of a natural lift?
I think it depends on each person as well, because your bone structure is very different. You can have deep-setted eyes, so the thing is that it will be down to the bone structure, the amount of fat and the amount of skin in that area. There's a few different treatments. I mean, sometimes clients, it is a surgical case, they will have to remove some of the excess fat and excess skin. But there is some treatments that will help the quality of the skin. Like Ultherapy will lift the brow and the upper aspects, so the muscle area here, it can cause a little bit of a lift. You can use anti-wrinkle injections to create a little bit of a lift as well. The actual eyelid itself, you can improve the quality of the skin with using your own blood cells, like PRP we mentioned earlier. And also you can use some lasers. Lasers will tighten skin as well. So really it can be a combination approach again, and I keep saying that, but it's really down to, again, the individual, how extensive that laxity is and what their structure is around that area that we can work on.
Fantastic. Okay, well look, I think that's all we have now. I think I could actually talk to you for days. I would have you driven insane with asking you all of the questions, but we have to keep it to a certain time limit. But thank you so much for talking to me, Anna. Absolutely fantastic, and I can say nothing but good things about Anna and the team. I have been so well treated in here, and I'm very excited to see the results because I'm already noticing some already. But thank you so much. And as always, if anyone has any more questions, I'm sure, Anna, if I do get any more, you don't mind answering them if I send them on to you. And maybe we can look at doing this again down the line and do a bit of an update. And of course, when I see my results in a few months, we can have a chat then. Before and after is very exciting. But for now, thank you so much for watching, and we will definitely see you again.